Good afternoon, ladies and gentlemen, and Happy New Year to each and every one. My name is Jendi, and today we're on the topic of HIV and AIDS, and we're going to be talking about antiretrovirals. Now, antiretroviral is a combination of medicines that specifically fights the HIV virus in one's body. There are many abbreviations for this medication. Some persons call it ARVs, ARTs, or simply antiretrovirals. But is there a difference? ARV is the abbreviation or shortened version for antiretrovirals. ART is the abbreviation or shortened version for antiretroviral treatment. Both refer to the same thing, the medication which fights HIV. Now, many persons have asked the question, can ARVs cure HIV? Unfortunately, the answer is no. There is no cure for HIV. ARVs are a form of treatment or medication that helps our bodies to cope better with the effects of HIV and therefore helps us to live longer, healthier lives. But it cannot remove HIV from our bodies once we are infected. Persons also ask, should all HIV positive people be taking ARVs? Well, according to the World Health Organization, persons should begin taking antiretrovirals as soon after infection as possible to protect the immune system from harm. However, this is not affordable for most individuals and countries, and there is some concern about the effect of very long-term treatment or treatment adherence. The accepted protocol for public health programs differ from country to country. During the time before you qualify for treatment and once you are on treatment, it is important to follow all the positive living guidelines to keep your body and immune system as healthy as possible. Now, do ARVs really work? ARVs work very well and really well for a majority of people. But we need to know that it may take our bodies a few weeks to adjust to the new medication, and therefore it may initially look as if it doesn't work or simply makes one sicker. Before a person goes on medication, he or she should be specifically prepared for this. One of the important things a healthcare professional or doctor will discuss with him or her would be the possibility of side effects. HIV positive people who are on ARVs and who experience side effects should not stop taking the medication, but should inform their healthcare professionals immediately. However, know that there are a small percentage of persons for whom ARVs will not work. If a person is already in a very advanced stage of AIDS, his or her body may not be strong enough to cope with the effects of the ARV medication. Persons also ask, are ARVs dangerous? ARVs are a really strong medication and they have side effects. In very rare cases, the side effects of ARVs could be dangerous, and therefore it is important to report all side effects immediately to your healthcare professional. It is also very important to follow the prescriptions your healthcare professional provides for the ARV medication. Another question that persons ask is, what are the side effects of taking the antiretrovirals? Now, all medicines are chemicals, and these chemicals affect our bodies in different ways. Sometimes some of these effects are negative, although the medicine is good for you. The unpleasant symptoms we may experience from medicine are called side effects. The side effects or symptoms experienced with ARVs are usually worse during the very first few weeks, as one's body is still adapting to the medicine. Note that many side effects can be treated if they are diagnosed early. Now, what are some of the side effects of ARVs? Now, bear in mind that not everyone will have side effects, and it is unlikely that one person will have all the possible side effects. So some side effects you might have would include nausea and vomiting, pain in the legs, headaches, severe skin rashes, not sleeping well or insomnia, painful stomach, bad dreams, tiredness, and diarrhea. These side effects usually go away after a few weeks. It is, however, very important to always inform your healthcare professional immediately, as some side effects might be serious. do not stop taking the treatment without speaking to your healthcare professional or doctor first. Now, are ARVs better than good nutrition? Keep in mind that it is not one or the other. A person who is still in the asymptomatic phase or at the asymptomatic stage will be very healthy, and good nutrition will help this person to stay healthy and to delay the harm to the immune system. It is also important to remember that when a person reaches the stage that his or her body needs ARVs, they will still need proper nutrition to complement the ARVs. So eat properly and then take your medication as well. Okay, so this is the first part in our talk about ARVs, and stay tuned for the next video, which will contain additional information on ARVs. Have a good day.